Hi, I'm Dr. Rajat Gupta, a board certified plastic surgeon working in Delhi. And what I want to talk to you today is about ultrasonic rhinoplasty. Rhinoplasty or nose job is a procedure done to improve the nose deformities, the shape of nose. A person may want a hump to be reduced, the nose they want it to be sharpened, the tip to be sharpened, or sometimes they have a drooping tip. So multiple things are there. They may have difficulty breathing. So you see there are multiple changes which a person may desire for the nose. Nose job is a very commonly done procedure in our practice as well as across the globe. There has been something of very recent advance in rhinoplasty or nose job surgery which has actually changed the way rhinoplasty is performed these days. There has been a very recent advancement in the technology we use in rhinoplasty. This technology has actually changed the way rhinoplasty is done across the globe. This tool or this technology is something I want to talk to you about today. This is called as ultrasonic rhinoplasty, or in other words, use of ultrasound waves in rhinoplasty procedure. Does this sound interesting to you? Do you think this is something which you are hearing for the first time? Yes, you may be hearing for the first time because we actually started doing ultrasonic rhinoplasty in India for the first time. Now, this tool or this technology actually uses ultrasound waves to modify the bony framework of the nose. Now, understand that if you have a nose like this, which is broad, the nasal bones are coming too wide, and I want to reduce the width of the nasal bones. So these nasal bones are actually fractured during the surgery. And when we fracture these bones, it has to be a controlled fracture, very precise, and we make the bones or bring the bones closer to give you a shape of a fine nose. This step is done by all the surgeons who do rhinoplasty across the globe. It's a standard step. So there is nothing new in that. The new in this is how this step is done, how this procedure is performed. So since time immemorial, we plastic surgeons were using a chisel and a hammer to break the bones. Yes, you heard this right. A chisel and a hammer used by the carpenters, all the laborers across the globe. Just that our chisel and hammer used to be very fine. So we would break the bones either from the inside or outside. We just break the bones with a chisel and a hammer and bring them closer. This was a standard rhinoplasty step performed everywhere. Now, the problem with a chisel and a hammer is it may not make the procedure precise. A surgeon's hand may slip. You may injure the skin. Invariably, you will injure the soft tissue covering over the bone. It's very difficult with a chisel and hammer, and it's impossible that it will just break the bone. Some soft tissue will get injured. Now, injury to the soft tissue delays your healing, makes the bruising stay longer, swelling stay longer, as well as causes pain. So, at the same time, if while doing a chisel and a hammer, the surgeon's hand may just twist and the procedure may not stay precise. He may injure the skin over the bones. These were the limitations with chisel and hammer. But with ultrasonic rhinoplasty, these limitations are not there anymore. So what do we use now for this? What tool am I talking about? This tool, which works on the principle of ultrasonic rhinoplasty, is called as piezotome. I'm proud that we were the first ones to have piezotomes officially in our country. And let me introduce you to this device. So this is the device. It's called as piezotome. It's by a brand called Cosmetic. It's an internationally approved device used across the globe. It has a pen-like tool on which we can apply different blades. Now, these are the different blades. If you can see here, these blades are of different directions, different teeth, depending upon what kind of fracture you want to create when each bone is a bone. Now, this blade is attached to the pen like this. And then we use this device to break the bone. We use this device to break the bone. The advantage of this blade is the edge of the blade actually oscillates and emits ultrasonic waves. Now that's the key, because these ultrasonic waves frequency is directed that they will just break the bone. So it will not have any collateral damage. Even if my hand slips and goes like this, the ultrasound waves will not injure the skin. And if I'm cutting on the bone, there will be not any collateral damage that it will injure soft tissue. So there will be no soft tissue injury. As well as, since the cutting edge is very fine and it goes by ultrasonic waves, it gives a very clean and smooth cut on the bone. So the procedure becomes very precise. Now understand, in cosmetic surgery, the game is of finesse. Anybody can cut the bone. That's not the game. The game is whether you achieve the procedure you want with absolute finesse, absolute smoothness, without any collateral tissue damage. No tissue damage, no inadvertent damage to anywhere around the bone. So this makes sure that the swelling is less after the procedure, the bruising is less after the procedure, as well as my procedures and my patients are pain-free. They won't have any pain even if we do their fracture, because we don't do any collateral damage to other tissues. So this is what I wanted to talk to you about. This is called as ultrasonic rhinoplasty. This is one of the most recent advancement in rhinoplasty, which is growing like huge across the globe. Lots of famous plastic surgeons who do rhinoplasties across the globe are now shifting to this. I was the first ones to have it in India, as I told you before. So we have huge experience using this tool in our patients for the last like 10 months now. I've tried to answer most of the questions I'm asked regarding ultrasonic rhinoplasty or the advancement in rhinoplasty. If you have any more questions regarding this, please write into us and I will be there to help you. Thank you.